Hello. Time for a video. Now, I don't have the case notes for this. I believe it's a nursing discharge letter. I'm just going to comment on the grammar vocabulary. There's a few things we have to have a look at here. Okay. So, Anne Ballard, 22 months old baby, or baby daughter of Christine Ballard. Okay. So this letter is with regard to your known patient, Ballard. Now, you don't refer to people simply by their family name. Now, if it's an infant, usually, and here it's a baby, you would either say Anne or baby Anne. Okay, so if it's a kid, you would call them Anne, but as it's a baby Anne will be fine, not a Ballard. So, and known patient, well, he wouldn't, I presume, I haven't seen the task notes, but I presume you're writing to the doctor. So from what I can see here or gather, this baby was injured and went to hospital, and I presume your task is to write to the GP and inform him or her what happened, what the treatment was, what they did in hospital, and what you want the GP to carry on, or if it's a community nurse, however, what you want the reader to continue to do in future. So, known patient, well, I wouldn't put that, and we don't usually use that as a phrase in any case. This letter is with regard to baby Anne, who has been treated for second-degree burns which resulted due to accidental scalding with hot water. Well, we don't really need that. You would mention that in the initial visit paragraph. Right now, some obvious things here. We've got some pronoun misuse. Now, I don't know if this is a typo. I hope it is, but you've got to be very careful because, this is one of the most basic mistakes that you can make, mixing up genders and names and pronouns, etc. So if it's like he, she, him, her, that's not good, because that's, again, it's one of the most basic errors and things that you should be getting right in terms of a patient. So the examiners don't take it kindly if you do that. Okay, she's been referred to you for further follow-up care. Is due for discharge. What? And right. This introduction, as I mentioned before about the purpose of why you are writing. Again, I haven't seen the task notes, but if it's a discharge, if you're writing to a GP or a nurse, I'm writing to update you on the hospital care of baby Anne, who is being discharged from our hospital today, or something such as that. Okay, so saying this letter is with regard, to your known patient. Say it right, make it clear right from the opening sentence. I'm writing to update you on the condition of, I'm writing to inform you, etc. Okay, now is due for discharge. Well, so probably she. But even if it is she, that's a very short sentence. Why do we have three short sentences here? Okay, so we've got one sentence, that it's not too bad. We've got a main clause subordinate. Then we've got a second sentence, and we've got a third. Now you could join all this information into a single sentence, or at least have two. She's being referred to you for further follow-up care, and is due for discharge, and is being discharged today. Initially, 16th of March, she presented, well, she didn't present she didn't come, she didn't present herself. Now, we usually use this verb to, to refer to when patients come to see you. They present themselves to you. However, this being a children's hospital, and again, I don't have the case notes in front of me, so I can't really say if she was admitted by hospital. Admitted by ambulance, or if the mother called an ambulance and she was urgently admitted, but presented doesn't quite work. So I'd probably make it was admitted, as I'm not sure of the circumstances. So hang on, let me sort that out. She was admitted with burns of a right trunk and arm region. I would have put that due to accidental scalding arm region, due to accidental scalding with hot water. I would have put that there instead of having it in the introduction. Okay. She was admitted with burns over right trunk and arm region due to accidental scalding with hot water. Therefore, the affected region was covered with prophylactic antibiotics and analgesics were administered. Now, I was talking about use of passive in a video yesterday, I think, of the day before. And I was saying, while passive use is good, if you're a doctor and you're performing some action, you don't need it because you are the one performing action. I prescribed, etc. But for this case here, use of passive is recommended because it's a hospital and the writer is the charge nurse, not the doctor. So presumably some other person administered the analgesics, etc. So in that case, passive works because, one use of passive is when you don't know who, or it's unimportant, say, who performed the action. Yeah. So you would be wanting to use a passive here in this kind of a letter because you're one member of staff, and in a hospital there's like nurses, doctors, blah blah blah. Anybody could have performed the actions. Yeah. So here use of passive is recommended. Okay, so Ballard, again, wouldn't use it. You could say Anne or baby Anne. Was well hydrated with intravenous fluids for 20 hours, and later on oral fluids were initiated. Furthermore, now, right, can you do a dressing or don't you apply a dressing? Make sure you have a suitable verb. Wound dressings were applied twice a day on a daily basis. Well, twice a day, so obviously it's on a daily basis. So that's kind of repetition or tautology. Twice a day on a daily basis. In other words, twice a day. So during Ballard's hospital stay, during baby Anne's hospital stay, her mother, don't forget, possessive pronoun, her mother appeared depressive. Therefore, she has been referred. Now, oops, I need a genitive case. Okay, baby Anne's hospital stay, mother possessive. Therefore, she has been. Now, you could use present perfect, but I would use, because we're talking about a particular moment in time, although we don't know how long that was, I would use she was referred instead of has been, because slightly better, because it's definite kind of time. Yeah. Therefore, she was referred to hospital social worker. Again, we need an article, to a hospital social worker. Now, you've got to watch this because I can see that there's a couple of things here. We've got missing articles, missing prepositions, pronouns. Okay. She was referred to hospital social worker. Presently, there is medications. There are. Subject verb, there are no discharge medications. However, please continue salvadine dressings. Furthermore, observe mothers. Right. So, who is doing this? Right. So, furthermore, can you observe? Would you observe? We want to know who you want to perform the action. Furthermore, can you observe? It would be appreciated if her mental status is observed. But I will make it yes. Furthermore, can you observe the mothers? Mental status, genitive. Also, don't leave that comma. Arrange an appointment with a local financial counsellor. Now, I can't remember. I think I've seen these case notes before. I think something about she was having some financial issues, but you've just introduced this here with no previous mention. You know, so the reader, is like, financial problems? What financial problem? What financial problems are you talking about? You haven't said anything about those. So if you're going to mention something later, you have to, give us some clue earlier in the letter. Then when we come across it, it doesn't seem like new information. Yeah. So with regard to financial problems, such as what? What's that got to do with the G? I mean, are you writing to the G? You went to maternal health, child health centre. So are you writing to a GP there or to a nurse there? I'm not sure, but would that be the job of the GP or the nurse to sort out your finances? I'm not really sure if that would be the case. Now, local support groups, when you go into the doctor's surgery or to a healthcare clinic or centre, if you look at the notice board, there's usually posters and advertisements, for mothers groups and support groups, etc. Yeah, so that would be part of it. I don't really know if they would help you with your finances though. Anyway, it would be greatly appreciated if you consider the case. Well, you're not just going to consider it, they will obviously do it, because that's what they do. They're not going to consider it and say, nah, I'm not taking that. Of course, they will take it and provide continued care to Anne, or baby Anne, and Christine, not a Ballard. And Christine. Okay, please nice to make a quiz, blah, 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 blah. Okay, so, bit of grammar. Watch the names. Be careful if it's a baby, if it's a kid, adult, etc. Watch those short sentences. Watch your verbs. And I don't know, again, I haven't got the case notes. I checked the word count, it's 195, so that's not bad. But you could have maybe put a little bit more background information to help fill out the story a little bit, I think. So, okay, that's the first video for today. I hope it helps.